Hello everyone, in this video we'll be discussing about the chapter wounds and wound healing. So beginning with wounds, here we'll be discussing about what is wound, the types of wound, and then comes the wound management, which is wound healing. So beginning with wounds, what is the definition? Wound is a break in the integrity of the skin or tissue, often which may be associated with disruption of the structure and function. We should not get confused with wounds and what is an ulcer. Ulcer is just a disruption or break in the continuity of any lining, maybe the skin, mucous membrane, or others. So, ulcers will come under wounds. So, wound is the break in the integrity of the skin or the tissues, which will be associated with disruption of the underlying structure and its function. So, coming to the classification of wounds, there are 6 headings in classification. You need to remember it as Rank and Wakefield classification. Then comes 3 T's and then 2 S. Rank and Wakefield classification, the time elapsed, the thickness, and the type. And 2 S's involved, the structure involved, and surgical wounds ka classification. Beginning with Rank and Wakefield classification, he classified into 2 types. Either it could be tidy wounds or untidy wounds. So tidy wounds are those wounds which are likely to be caused because of a surgical incision or by any sharp objects. They'll be just incised, they'll be clean and healthy wounds without any tissue loss. So for this, healing is by primary intention and primary suturing can be done for these. Coming to the untidy wounds, here the wound is a little bit more than that of the tidy wounds. They can be due to crushing, tearing, avulsion, devitalized, vascular injury or multiple irregular wounds or due to burns. Here, the fracture of the underlying bone can be present. It can be undergoing any infection and they'll usually have delayed healing. For this, secondary suturing, skin graft or flaps may be needed and secondary intention is the management for this. So Rank and Wakefield classified into tidy and untidy wounds. Tidy wounds are simple surgical incised wounds, whereas untidy wounds are due to any tearing, crushing or avulsion wounds. So for tidy wounds, it needs primary suturing, whereas untidy wounds want secondary suturing and secondary intention is the healing method. Then comes the second type of classification, which is type of wound. Here it is mainly, you can remember it from the forensic medicine part, like incised wound, lacerated wounds, stab wounds, penetrating, perforating or puncture wounds, any bruise or contusion and hematoma. These are the type of wounds. So clean inside wounds are just tidy, simple, clean cut wounds with a linear cut edges. It is usually treated by primary suturing. Whereas the second one is lacerated wounds. Here it will have ragged edges. For this, proper adequate wound excision must be done, thorough warm saline wash and suturing of the wound by layer is required. Bruise or a contusion. It is because of any blow or a blunt force to the skin and tissue underneath wherein the blood vessels or capillaries are damaged underneath. So, because of this blood vessels are damaged, they will have skin discoloration. It can usually be seen on the lax areas of the face, scrotum, eyes. Children and old age and fair skinned people are usually these bruise and contusions are prominently seen. Whereas the hematoma is an important question wherein there is collection of which is localized collection of blood after a blunt trauma or after surgery can be seen. This blood which is getting collected will get clotted in few minutes to hours. Later it eventually liquefies to form a discolored fluid. It is usually seen in the subcutaneous, intramuscular, subfacial and the intra-articular region. Because there is collection of this blood, it is prone to get infected and which will lead to formation of an abscess. Some varieties are any small hematoma which can be seen on the scalp. So as already told, abscess is one of the complications. So complication is just an abscess. For this, incision and drainage should be done. Cosmetically, hematoma is not good to be seen. Hematoma can occur spontaneously in coagulation disorders like hemophilia. Then the next type of wound is abrasion wound. These are just superficial injuries and it is due to the shearing of the skin. The tangential force causes loss of epidermis, exposing the dermal vessels and nerves, leading to profuse painful oozing. Puncture wound just causes a hole on the underlying skin. Penetrating wounds enter the body cavity, and then the perforating wound will exit through from outside the body. So puncture, penetrating and perforating wounds. So puncture wounds are just a small hole and they usually look like bites. It is usually a stab wound. Here the depth of the wound is more than that of the width. Foreign body or objects may be seen in such wounds. Whereas penetrating wounds enter the body cavity, like any abdomen or chest are the common sites. Traction and avulsion injuries. These are complex injuries where the tissues are displaced from their normal anatomical positions. Coming to crush injury, it is a major wound. It is usually seen in disasters like earthquakes, any tourniquet injury. It leads to compartment syndrome. Compartment syndrome is there is increase in the pressure in the compartments. So which leads to damage to the underlying muscles and the nerves. Because muscles are damaged, it will lead to myoglobinuria because of acute tubular necrosis. So they will be identified as dark colored urine and eventually it will become anuria or oliguria. Gunshot injuries are other types of wounds. There can be injury to the bones in the joint, and at last there is injury to the nerves, arteries, veins and deeper organs. The third type of classification of wound is based on the thickness. It can either be superficial, partial thickness, full thickness, deep wounds, complicated, and then comes the penetrating wound. Superficial will only involve the epidermis and the dermal papillae, whereas partial thickness will go up to the deep dermis. Full thickness also involves the subcutaneous tissue. Deep wounds will involve the deeper structures and the muscles. Complicated is when which is associated with injury to the vessels or the nerves. Penetrating, I have already mentioned it, it will lead to cavities and organs will also be involved. The next classification is involvement of structures. Simple wounds involve only one organ, whereas combined wounds will have a mixed tissue involvement. Based on the time elapsed, it can be acute or chronic. Acute is when they progress through the normal phases of healing. It is usually less than 4 weeks. Whereas a wound is considered chronic if healing does not occur within the expected period according to its etiology and localization. These chronic wounds are further classified into typical and atypical chronic wounds. Typical wounds include ischemic, neurotrophic, hypostatic ulcers and diabetic foot and decubitus ulcers. Whereas atypical chronic wounds can be caused by any autoimmune disorders, infectious diseases, vascular diseases and vasculopathies, metabolic, genetic diseases, neoplasms, external factors, psychiatric disorders and drug-related reactions. These are prone for hypoxia and then infection. When infection occurs, it will lead to biofilm formation. The last type of classification is based on surgical wounds. This will be dealing in detail in some other video. Just remember that surgical wounds will be classified as clean wound, clean contaminated wound, contaminated wounds, and then the dirty wounds. This is all about wounds, which is type of wounds. So first we discussed about what is wound, the definition of wound. Then there are 6 classifications for wound: Rankin-Wakefield, the time elapsed, the type of wound, and then comes the thickness of the wound, and at last we discussed about the structures involved and then the surgical wounds. So now let's begin wound healing. Wound healing is a complex process to achieve the anatomical and functional integrity of the disrupted tissues by various components like neutrophils, macrophages, lymphocytes, fibroblasts, and the collagen in an organized, staged pathway, which involves hemostasis, inflammation, proliferation, the matrix synthesis, then comes the maturation, remodeling, epithelialization, and then comes the wound contraction. You need not remember these. Just for the sake of staged pathway, you can write this if you can remember. But in wound healing, the most important things are type of healing, the stages of wound healing, and the phases of wound healing, and then at last comes the factors of wound healing. So, what is the types of wound healing? There are 3 types of wound healing: primary healing, secondary healing, and then healing by third intention. Primary healing is also called first intention, secondary healing which is secondary intention, and then the healing by third intention or the third intention can also be called as tertiary wound healing or delayed primary closure. What is this intentions? So primary healing, which is the first intention, is mainly seen in clean incised wounds or surgical wounds, where wound edges are approximated with sutures. There is more epithelial regeneration than fibrosis. This word is important, that is regeneration than fibrosis. So whatever scar forms will be linear, smooth and supple. Whereas secondary healing and secondary intention or second intention, here there is extensive soft tissue loss, like in major trauma, burns and wounds with sepsis. Here healing is slow and is usually by fibrosis. So there is a white scar which is formed. Reepithelialization occurs from remaining dermal elements or wound margins. So only differences here is simple incised wounds. Here there is massive soft tissue injury. In primary intention, the scar formed is linear, smooth and supple, and it is mainly by regeneration. Whereas secondary healing, here it forms a white scar and the healing is by fibrosis. Whereas healing by third intention or tertiary wound healing or delayed primary closure is where after wound debridement and control of localized infection, wound is closed with sutures or covered using skin graft. This is done because initially if we will close the wound by suturing, the infection may still be inside in the wound and it is more prone for any abscess formation or any other complication. So it will be delayed. After the wound debridement and control of local infection, we will be using any sutures or using a skin graft will be done after some time. So only it is called delayed primary closure. Primary contaminated or mixed tissues wound heal by tertiary intention. Then comes the stages of wound. This is important for 3 marks. Like the stages of wound healing are hematoma and inflammation. Then comes the granulation tissue formation, which will be further continued by epithelialization. Then comes the scar formation and then the maturation. This you must write in a proper way. Hematoma and inflammation, granulation tissue formation, epithelialization, scar formation and resorption, and then at last is the maturation. Then phases of wound healing. There are 3 phases of wound healing, which is the inflammatory phase, proliferative phase, and then at last comes the remodeling phase. They might just ask you to name it or they might ask you as a 5-marker question. The inflammatory phase is the lag or substrate phase or the exudative phase. Remember, these 3 phases are, the duration is important. First one is for 3 days, then comes from 3 weeks to 6 weeks, then at last it is for 6 weeks to 6 months. The first one, which is the inflammatory phase, lasts for 3 days, which is 72 hours. There is initial arteriolar vasoconstriction, then comes the thrombus formation and then the platelet aggregation due to endothelial damage. And here there is release of adenosine diphosphate. This is a MCQ. Then later vasodilation and increased vascular permeability occurs. These 3 things are important. Hemostasis, coagulation and chemostasis occurs in this phase. All these causes features of acute inflammation, hence the name inflammatory phase, which will lead to rubor, calor, tumor, dolor and loss of function. Rubor is redness, calor is heat, tumor is swelling, dolor is pain. The second phase is the proliferative phase. This lasts from 3rd day to 3 to 6 weeks. Here there is formation of granulation tissue. This is all about proliferative phase. It is also called fibroblastic or collagen phase. The third phase is the remodeling phase. It lasts from 6 weeks to 6 months to up to 1 or 2 years also. Here there is replacement of type 3 collagen to type 1 collagen. Here it is again an MCQ. This is all about phases. Now we know what is wound healing, the types of wound healing, the phases of wound healing and the stages of wound healing. Coming to factors of wound healing, there can be certain local factors and general factors. Local factors are, we'll be focusing about the wound. How is the wound? Whether any infections are set in, necrotic tissue and foreign body are present. For the wound, if there is any poor blood supply or there is any venous or lymph stasis, tissue tension, hematoma, if the wound is a large defect, recurrent trauma occurs at that site, X-ray irradiated area, the site of wound, example wound over the joints and the back has poor healing. if it is underlined with any osteomyelitis and malignancy, if the type of wound is incised or lacerated, crush or avulsion injury, then if there is any tissue hypoxia. Whereas the general factors are regarding to the patient, like what is the patient's age. In younger age group, wound healing is faster and better. If the patient is obese, smoking, alcohol, stress, any ill habits, if the patient has any malnutrition or any deficiencies of vitamin, zinc, copper, manganese, anemia and hypoxia is present. If the patient has any malignancy, uremia, jaundice, immunosuppressive diseases underlined with him like HIV, diabetes, metabolic disease, or if the patient is on steroids and has any neuropathies. For nutrition, you can specify like vitamin A, E, C, K deficiency, zinc, manganese and copper deficiency. Glutamine is the most abundant amino acids in plasma, which is a major source of energy for rapidly proliferating cells such as fibroblasts, lymphocytes, epithelial cells and macrophages. So the deficiency of glutamine also plays a role. This is all about factors of wound healing. For wounds, the last part is the management of wounds. This you will be writing in 4 headings. Firstly, you have to assess the wound, then comes wound cleaning, then the specific treatment for the wound, and the last one is other management. For assessing the wound, here you have to do inspection and the palpation. The wound is measured either in 2 dimension or in 3 dimension. Detailed history in relation to the mode of injury must be taken. Examination should be done. The function, extent of injury, involvement of the deeper structures like nerves, vessels, bones, organs, the level of contamination, if there is any foreign body, and if there is any presence of swelling. The second one is wound cleaning. It is usually done by irrigated or washed with warm sterile isotonic normal saline using a sterile syringe. Here there is an acronym called TIME: tissue, inflammation, the moisture balance, and the edge of the wound. You need not write this, only this warm sterile isotonic normal saline part is important for wound cleaning. Here the TIME ka acronym is for assessment of the tissue, then assessment of infection and inflammation, then assess the moisture imbalance, and then assess the edge of the wound. This is just to remember how to assess stuff in wound. Then at last comes the specific treatment. Specific treatment varies for different type of injuries like minor, it could be major, or if there is any hematoma, or if it is a crushed injury. For minor injury, you just have to clean the wound, that is cleaning the wound with saline, and then primary suturing can be done for minor injuries. Whereas for hematoma, you need to decrease the swelling part. So ice packs, compression bandage, elevation of the part will usually be done for hematoma. For crushed injuries, delayed primary suturing is done. Then a split skin grafting can be done for crushed or devitalized wounds. For major wound, it depends on the structure involved. The major vessels are sutured using 60 non-absorbable polypropylene sutures. For nerves with clean cut ends are sutured by primarily using 6070 polypropylene sutures. For any internal injury, laparotomy, craniotomy, or intercostal tube drainage can be done. For the other managements like managing infections with antibiotics, shock with fluids and blood transfusion, electrolyte management, and tetanus toxoid injection and anti-tetanus globulin should be given. There are 3 types of wound suturing. It can be primary suturing, delayed primary suturing, or secondary suturing. This is classified based on the time. Primary suturing is done by 6 hours, delayed primary suturing by 48 hours to 10 days. Secondary suturing is by 10 to 14 days. This is usually done in infected wounds. This is all about wound management. To summarize wound healing, initially we saw what is wound healing, then the 3 types of wound healing, which is primary, secondary and third intention, then the stages of wound healing, then the 3 types of phases of wound healing like inflammatory phase, proliferative phase, and then at last comes the remodeling phase. Then we saw about the factors of wound healing, which is the local factors and the general factors, and then at last the management of wound, assessing the wound cleaning, the specific treatment, and then comes the other management. At last we saw what are the three types of wound suturing. Thank you.